Okay, so
Are we all set up in here? Did it all
I
work
think
fine?
this, so far this looks, but here you have to try, why don't you try to connect your
do I-
slides?
That's why I'm here.
Yeah.
So if you, I didn't even realize, I don't know if it's a touch screen or not, but if you
Yeah,
hit
it is.
share screen. And then
Hi, it's Chicago. This is Sydney. Can you just say something so I can see if we can hear you here?
We're muted.
Okay, hi.
Great. Yep, we
What's
can
your
hear.
email address?
Okay.
Your email.
We're just figuring out some technical share screening, screen sharing issues. We'll be right with you.
There should be
I forwarded something called Final Program,
final confirmation email.
and it should in.
Yes.
Just make sure. There we go.
Tyler's forehead.
Our
Oh
section.
boy, I
I feel
can,
like.
I can use my hands. I don't-
This one, I believe, right? Or are we, yeah, 4 o'clock? Am I gonna be right in your way if you're looking at the screen right here?
We're good.
I can slide to the side, okay.
You go, I can try.
There we go.
You didn't stop share for me here.
Sydney, I'm gonna mute us for a few more minutes until we get everything up and running. We'll be right with you.
Allow.
Had to go virtual, right? So
Okay, Sydney, we got
that
our
was
issues together.
because I was having, it was like 3:00 in the morning for me. And India was some ungodly hour and yeah. Yeah,
Well, planning this too.
I bet.
Yeah.
But
You-
Okay, I think we're ready to start. We're just about on time, I think. Sydney, are you with us?
Oh, you're muted now.
Sydney is muted. Do we have anyone in Sydney? Sydney, it looks like you're muted if you hear us. Try to send a chat and see. But I think that now the time is there, so I think we will just get started. So I will give the two of you, run the three,
Everybody.
four of you, the word, and you can introduce yourself.
Good afternoon, everyone. The title of our workshop is Let's Get It Together, Mixed Methods Pharmacy Research to Address Social Determinants of Health. And before we get started, I would like to introduce my team and we'll go through each person. My name is Alina, and I think most of you met me already from the previous presentation. I'm an assistant professor at University of Tennessee, and my main research area my focus is social determinants of health, HIV, substance use disorder, and qualitative research. And we'll go to next speaker, Dr. Hageman.
Okay, I'm Tracy Hageman. I'm also from the University of Tennessee College of Pharmacy on the Nashville campus. I get the pleasure of working with Alina directly. I'm an associate dean and I'm also a professor at the college. I am a clinician, so I spent 20 years in pediatric pharmacy and oncology and hematology. And now in my administrative role, I've had to morph. So now I'm focused in women's health and still some pediatrics, but not active practice, and vaccination research with social determinants of health and vaccine hesitancy.
Dr. Melton.
That's me. Hey, I'm Tyler Melton. I'm colleagues, these wonderful folks. I'm on the Knoxville campus at the University of Tennessee Health Science Center. I did a research fellowship where I got my master's of public health, and that's when I really got engaged with public health and kind of understanding more about prescription drug misuse. primary emphasis for my research and also coordinate rural health program here is of course rural health, and then more research interest in prescription drug misuse. And that's my email in case anybody wants to email me.
Dr. Schomer,
Hi, I'm John Schomer. I'm from the University of Minnesota, and I'm delighted that the Tennessee team would invite me to collaborate. I was working with Alina as she was completing her PhD at University of Minnesota, and our graduate program has been trying to grow in getting better and better when it comes to mixed methods research. And Joe Gaugler, who is a professor in nursing, really has done some great things. And so our graduate students have benefited, and there's a lot of good support. And so even though Alina is now an assistant professor at a different place, she still consults with us because we have several PhD students using mixed methods and qualitative inquiry. So thanks for inviting me along.
actually, it's a pleasure because we are bringing a team, a so diverse team. And I think in order for us to become champions in the social administrative pharmacy, we must collaborate with clinicians and other researchers. Without clinicians, I would not be able to have a successful defense of my PhD thesis. So we'll talk very briefly about the objectives of this workshop. The main one is to explain the value of incorporating mixed methods into research, and how we describe the social determinants of health, how we incorporate it into our mixed methods, and identify the challenges using the social determinants of health in mixed methods, and also identify opportunities for application of social determinants of health in the social pharmacy. And one of the main aims is to uncover the rising needs of mixed methods in the social pharmacy, to explore its applications in a different type of settings, can be clinical or not limited to clinical pharmacy, discuss the application of the mixed methods in organizational, clinical, and academic centers, I think more of subtle here, and maximize the application of the mixed methods in social pharmacy. And we went through the review, and we'll talk a little bit about social determinants of health. We have two different definitions, and I was wondering, is everyone familiar with the definitions in this room? And I don't know if Sydney can hear us, but if they, I don't know if they're familiar.
Sydney, can you confirm, are you familiar with the social determinants of health?
I see a hand here on my screen. Jack Collins said yes. Wonderful. So I will not go through the social determinants of health definitions, are a little bit different. One is the WHO is more global versus the CDC, it's more local for the United States. And this is how I think, local versus global. And we have 5 different aspects of social determinants of health. As you can see on the wheel, we have access and quality of education. We'll go to economics stability and all the economics factors. We have social and community context, the neighborhood, and creating an environment. And one of the aspects is healthcare, access and equality. And here we have a blend of mixed methods. Mixed methods means we combine qualitative with quantitative. Quantitative can be survey, but should not be limited to survey. We can think of large databases. For example, access to, let's say, Medicare or Medicaid data in the United States, or if you have a European country where you have access to data, healthcare data.
Health registries.
Health registries. And we'll go very briefly through qualitative research. We have a few methods, interviews and focus groups. Most of the time, we see this methodology. However, observation, it's another methodology which we rarely see these days in manuscripts, and I think it lost its value because it's so much time consuming. Especially observation, I read a few manuscripts a few years ago. A researcher spent 4 months in a nursing home observing patients with Alzheimer. And because she could not interview them, just observed their behavior, how it changed over time. And this was another dissertation, another method of qualitative research. Interviews mainly we use mainly when we want to extract data, and if we have privacy issues and we don't want to disclose information, versus focus groups when we want to get a collective idea from focus groups. And most of the time, a framework will guide our interviews, interview guide or focus group. And very briefly, data analysis is done inductive or deductive. It depends on the methodology. If we use a framework, then it's mainly deductive. But if we don't use a framework, we'll have inductive data analysis. And a few more information about, we have content analysis and thematic analysis, and also phenomenology, which is especially we borrowed in pharmacy from nursing. In United States, it's mainly all the information we are getting is from nursing, and Van Menen is one of the fathers of phenomenology. On the other hand, grounded theory, I will just give an overview. All the time, whenever I see a grounded theory study, it has to extract a new framework or a theory from that interview or focus group. However, sometimes, and I do not want to criticize my colleagues who are doing qualitative research, but if they are just presenting themes, this is not grounded theory. A grounded theory started in 1965 by Strauss and Corbin, and they purposefully said extract the framework. So in the pharmacy world, in some researchers might not be familiar with grounded theory, and if you are using the correct framework, you should extract a framework and present that framework in the context. And it's very important to reach saturation, and saturation started with grounded theory, where no more information is added after the interviews. And sometimes I get rejection. We talked about rejections today. I got rejected because my sample size was not enough to conduct a logistic regression. And it was 14. And my response to the editors was, here is how qualitative research is conducted. We do not use statistical analysis. We do not use a statistical tool to determine the power of our study. And here are some references. If they do not consider my references, it's a shame for both of us, but I'll move to another journal where hopefully I'll find a researcher who understands qualitative research. Ethnography, it's another methodology of qualitative. And when I think of ethnography, I always think of culture. And I noticed some of my colleagues are saying, oh, we can combine phenomenology with grounded theory or ethnography in the same study. And I said, no, you select one type and you stick with that one. It depends on your research question, how you design your study for qualitative versus quantitative. I think it's a little bit more easier to design because it depends on your sample size, what you can do with your data analysis. Versus qualitative, we have to think through what's our research question, what we want to achieve at the end of the day, or at the end of the research, how we study. Does it make sense? So when I think of ethnography, I always think of culture. And if I want to study a cultural part of, let's say, Asian population in United States, the medication experience of diabetes, I'm just making up. I would prefer to use ethnography and look how culture is intertwined with the patient to derive those themes. The naturalist inquiry, or that one is more bibliography or a story. We want to obtain the story from the patient, and we allow the patient to come up with their stories. Most of the time, if we just throw the first question, could you tell me your story? If they are not willing to share it, we use more probing questions. But if they are willing to share it, we let the researcher to talk, the interviewer to talk to the researcher. And case studies, it's more a kind of combination of little cases to put together in a different perspective. Any questions before we go into our activities? Yes.
So in ethnography, you're talking about culture, but it could also be culture of a group, for instance.
Correct.
So
Yes.
pharmacist culture.
Yes,
so
pharmacy
GP
culture, yes,
So
I agree with you. It
And-
doesn't have to be just culture of, yes,
of ethnic groups.
groups, yes.
So also I was wondering if you can say something about the difference between ethnography and ethnomethodology.
I don't know it very well, that part, Dr. Schomer,
Yeah, I was gonna ask the same question, just
because
there's different methodologies, and I always turn to PhD students or people, but what I've learned is that ethnomethodology will apply different methods to do an ethnographic
yeah.
understanding. So I remember one presentation was, we did a windshield study. And what they did was they drove around and they looked out of their windshield of their car. And that was a methodology that I'd never heard of before. So I think they're intertwined, but there's,
yes,
and another question I have is, we have people that do this. What is missing that you can think of? We tried to be exhaustive, and I noticed there's 7 people, maybe logging in from home. If anybody has others to add to this list,
Yeah.
I would be very, very,
and this is
Appreciate-
one learning opportunity for us. Maybe we miss something, because most of the information in qualitative, we are taking from nursing. And they took it mostly from sociology and psychology.
Anthropology.
Anthropology,
Probably,
yes, I
yeah.
agree with you.
Narrative.
Narrative, yes.
Analysis would probably
Narrative.
cross over into the
Yep.
naturalistic one. but
Yes.
That is
Yeah.
something as well,
yeah,
maybe.
that's good.
Yeah, and the big,
And if people at home, if anyone at home has some input on this, put it in the chat and I'll give you what you think.
yeah.
I've used Dr. Google to find out what ethno.
Oh, good.
Using my tools here.
Yeah.
So, yeah, yes, you were saying about ethnography, right? We know that that brings in the customs and the culture of different people and cultures. So here we go. Ethnomethodology is a method of sociological analysis that examines how individuals use everyday conversation and gestures to construct a common sense view of the world.
Wow.
So I'm just trying to look further.
The gesture part's pretty neat on that.
Yeah,
Now,
that's
let's
different.
see. The person who is presenting from New Zealand is not with us. That was
Yeah.
that was
That
fascinating
really
what she was
interesting.
doing,
Yeah,
I don't remember.
adapting her methodology to say, okay, this is, yeah,
Joanne, yeah,
Joanne?
yeah,
Bet that's the way forward, actually, in many settings where you can do that in another way. It's interesting.
so before we go through our activities, I would like to ask how many of you are doing qualitative research, and what are usually the topics of your qualitative research?
I'll start and then we can go around
Yeah,
and then
I'm
we can go to the other sites. John Schomer, University of Minnesota, and I apply it to understand what I call the medication experience, the experience or the relationship that patients will have with medications. And it's a great way to listen to their voice. And we heard it earlier, and I was taking copious notes earlier during the presentations, listening to in their own words how they describe it. And I use qualitative inquiry to try to get their voice, not my voice, because I'm biased. And so that's how I use it.
Yeah, we work with qualitative work. We use quite a bit of both interviews and focus groups. We've also done some observation lately on our educational research we're doing. So we've had an educational researcher that sits in on our teaching and observes the class, which has been very interesting and gives a lot of interesting data for us. We've done some on interprofessional collaboration, some interviews and focus groups on that. And on the workforce as well, actually, but also the same way as you say, John.
My main focus was on HIV, AIDS, also people with substance use disorder. And these days, because I work in academia, I started doing focus group with students, understanding the de-prescribing in the pharmacy curriculum. So how to improve our pharmacy curriculum and address the needs of the students.
Hi, I'm the latecomer. My name is Lisa Gergis. I'm from the University of Alberta. I use qualitative description and interpretive description. There are different versions of qualitative research. And I kind of have two piles, kind of similar. One which is on patients, and I think the neatest stuff we did was patients with asthma and how they experience when they are in and out of control. That was really neat. A lot of my work is around pharmacists and implementation, whether it's prescribing, communications, but like what new things are they doing and how are they fitting that into practice? So that would be the other pile. And mainly focus groups, audio recordings of conversations and observations are probably the three ways I generate my data.
Hi everyone, I am Asmali. I'm a first year postdoctoral fellow at the University of Wisconsin-Madison. My major is gravity tuning. My current research that I'm leading currently is more of a qualitative inquiry working with the Muslim community. It's about understanding their medication use and focusing on type 2 diabetes and how they manage diabetes. So within that, we started with, I'll be sharing some of that also in my presentation, but within this group that we're working with, we're focusing on a diversity group that speak different languages, and that's kind of interesting challenge that we're working through. So that's what we're working with.
Tracy Hageman again, and again, I'm a clinician, so I pair up with people who do this, but some of the collaborative mixed methods, I guess, that we have collaborated on, really mostly around vaccine hesitancy, not just with COVID vaccination, but currently have a project with HPV vaccination for older adults, not the adolescents, but the older adults. So the 26 through 46, I think that it's approved for. Getting ready to, in light of all of the issues in the United States around the Supreme Court's recent ruling, and being in Tennessee, which is very, very, yeah. So we're getting ready to look at, in Tennessee, pharmacists can prescribe birth control if they complete a qualified program. We're not having much uptake on that. And so the next step is then doing some potential mixed methods research to look and see what are the barriers and how can we get this done? Because yeah, it's going to be a big deal.
Yeah.
So
it's really important work.
Yeah.
Good luck with that.
Thank you.
So I'm Betty Tuning, and I've done a lot of, I guess, interviewing throughout the years, looking for themes from the interviews, and some of my earliest work was actually with Indian nations up north, trying to understand what their idea of a healthy individual was, because we were developing programs for their kids. And we wanted to start with their perceptions of what health was. So that's an example. But I've also been involved with a lot of stakeholder focus groups where, again, we identify themes that emerge. Most recently, working with one of my students who is looking at people with diabetes, adolescents who are interested in meditation, not medication. I mean, they are taking medication, but so anyway, I've done a lot of different things. And the last thing I'll just say is so much of my work is around communication between patients and pharmacists. So that has involved a lot of observation. And then from that observation of the interaction, identifying coding schemes. So moving from that kind of qualitative work to the point of being able to measure with reliability, with good reliability, what's going on between the two of them. So.
My name is Amna. I'm a PhD candidate at the University of Michigan, and I helped a nursing professor at the University of Michigan with her project on video reflexive ethnography, and we were doing that to assess the feasibility of using that method in clinical pharmacists in the oncology realm to see if we could improve patient counseling about their side effects from oral oncolytics. So we would tape their counseling sessions and then have them watch it. And we would then elicit feedback from the pharmacist to see, like what they think of their counseling and what they could add and what they could improve. So that was a really cool experience.
Hi, I'm Marcia. I think I've met everybody. So I have had experience with focus groups, interviews, and doing content analysis, when like, for example, doing a survey and then analyzing, open-ended comments and things like that. So two recent examples. One, I worked with a team where we looked at patient perceptions of pharmacogenetic testing and the roles of pharmacists. And that involved interviewing patients. So that's one recent example. And then another project, it was mixed methods. So we did surveys of physicians, pharmacists, and patients. And then we had a lot of open-ended questions, qualitative data to analyze. So that's another recent one. So kind of doing both the survey and then getting all this rich qualitative data and then going through with coders and identifying themes and things like that.
So it's Tyler again. My journey with the qualitative analysis started with focus groups, with community stakeholders to see what pharmacists could do to better support like ancillary, like healthcare professionals, like mental health care providers, to see how they could get more involved and be more supportive about preventing prescription drug misuse. And that kind of led to prescription drop boxes and making sure we're properly disposing of medications, not only like to be environmentally conscious, but just also to have that removal of the risk of prescription drug misuse. And it's now kind of going into content analysis of PBM reform that's happened nationally on a couple of different things and how that affects rural health. And then I had to start a rural health certificate in my current program. And so there's a lot of planning going on to see the best way to keep continually improving the curriculum, making sure that we're meeting the marks that we need to be able to develop a rural health workforce. So a couple of different irons in the fire on that.
Okay, I want to invite the people who are with us here. Sydney, do you want to unmute and share your experiences with qualitative research?
Can you hear us at all?
Yep, now we hear you. Good.
Good. Obviously faculty at Monash University in Victoria, Australia. The research I'm involved with at the moment is looking at the policy framework of pharmacy and determining how that affects the opportunity of the role of pharmacists in delivering healthcare, particularly in the primary care setting. Techniques that are in use, obviously, content analysis, looking at the literature, but of course, a lot of policy is not in the academic research literature, so there's a lot of grey literature research here, and also obviously interviews and the techniques I've used previously and apply them in this case here. The interesting part of the work here is how you bring grey literature into a more academic discipline. So it's the area that I'm playing with. We'll talk about business plan.
Oh, my name is Deborah. I'm a recent graduate from the University of Sydney, in Sydney. And so the research that I did for my honours project was into the role of pharmacists in assisting athletes reduce the rate of unintentional doping. So we did a pseudo-patient study, so called up different pharmacies, spoke to the pharmacists, and then analysed that data for what advice and knowledge pharmacists currently have, because there isn't a lot of first-hand research and a lot of survey data, so we wanted to try something a little bit different to understand pharmacists without that kind of inherent bias that kind of comes with surveys. So yeah. Hey.
Thank you.
It's up to you.
Research I've been involved previously, things like content analysis of surveys, some contribution to focus groups, and also interviews, one-on-one interviews. So the project I'm actually looking at protection of public health and pharmacy in Australia, particularly in Australia, but also as well. So primarily thinking about how that applies in Australia, using interviews for that, as well as content analysis of surveys, and really testing
Falling out a little bit here. We're losing the sound a little bit.
Sorry, did you get which bits will I start from again? Are you right?
Yeah, now we hear you better. Yeah.
Thank you.
Yeah.
Yeah, move that one.
So I work with Robin on the public health, but I think for me, we've also done some work on a narrative inquiry, looking at transgender patients, looking at transgender health care. The other interesting one, opinion is also tried to apply maybe a bit loosely ethnography to a rural culture in terms of looking at sort of rural patients' perspective and just for to deliver access to healthcare.
Thank you.
Probably wraps up. Sydney, if you want to move on to the next one.
Okay, we have a comment here from Jack Collins. I'll read it up here. He says, hi everyone, I'm a postdoc at University of Sydney. I've had some experience conducting mixed methods research with simulated patients combined with interviews with participating pharmacists and the simulated patients as well. I also use discourse analysis, a qualitative approach I should have mentioned earlier, for one of my mixed method PhD students investigating implicit bias in pharmacists. So that's interesting. I'm just going to see here who else we have with us. Ahmed, do you want to share something with us? You're muted now, but. No?
I don't know if this will help with the sound, but sometimes students will tell me that I sound like a robot, which is like this, and they make me change the microphone that I'm using,
Yeah,
and then it fixes it. So I don't know
could be.
if that's it or not. Maybe leave well enough alone, but
Yeah, we can take that with us too further. Okay, well, we're not hearing from Ahmed. If you have comments later, come on with them. I think we'll move on.
Definitely. We'll, we'll, we'll break in groups of 3 or maximum 6 at this stage. Will be, especially in the Chicago area, will be groups of 3, and we'll take 45 minutes to discuss how qualitative and quantitative methods can be designed in different projects. For example, if you are working on a SOTL, especially on a scholarship of teaching and learning, and if you would like to share with us, it will be fantastic. Or if you are working on a clinical study, you would like to share your knowledge about how to design maybe an RCT or the new RCTs, which are smart RCTs. We have a smaller sample size, or a public health, any public health initiative. Please feel free, and we have 45 minutes, and then we will have a break, and we will come back for the second hour to debrief and talk about it.
okay.
So we have a little bit more than 45 minutes now, right? With the time until 5:20. So if we need a few more extra minutes, we have that. So then Sydney, I think we'll let you discuss on your own, and we will mute ourselves. And we'll link up on the next Zoom link later. So thank you.
you just get started and then.
I know, that's what I
I know.
felt. We're just.
I was telling my colleagues.
I am just gonna
This is a
say to
workshop.
Sydney as well now, we are now at time for break, so we're gonna end this connection. And we'll connect through the new Zoom link for the next one. Thank you.
Studies to get to where we want.